Autism is a neurodevelopmental disorder affecting about 1% of the population worldwide. It has many features seen in like social interaction problems, repetitive behavior. These kids are mostly hyperactive. Though there are a couple of treatment options available, especially FDA-approved drugs, but they have limitations too. So there is always a need for better treatment options. There is no clear theory for the cause of autism spectrum disorders. Some research have shown gene is involved. Some of them are indicating environmental factors are involved. However, the most important theory so far, which is well implicated in autism spectrum disorder, is the testosterone hypothesis. So those kids who are exposed to or who were exposed to testosterone, higher levels of testosterone during development in their womb, they have a higher prevalence of developing autistic characteristics. So the most important or the striking observation in autistic research is the more prevalence in boys. 5 times more incidence in boys compared to girls. How it is possible, nobody knows. But the available literature in the scientific community shows that it could be related to testosterone, the male sex hormone. Based on the higher prevalence of autistic feature in males and also the testosterone theory, we were interested to see whether the female sex hormone, that is estrogen has any role in autistic phenotype. Estrogen is a neuroprotective molecule, and many studies, especially from rodents in animals, have shown that estrogen can protect our brain from toxicity. So we were interested whether females, naturally they have more estrogen, so there might be a role of estrogen in protecting their brain compared to males who have less amount of estrogen. So what we did, we compared the postmortem brain samples from autistic kids as compared to control subjects, and we looked for the estrogen receptors, because estrogen is a molecule which should bind to a receptor. And we found that a key receptor which is involved in estrogen's action on behavior is significantly low in autistic kids, which is the first observation in this field that estrogen signaling is impaired in autistic brain. So this is the first, as I said, this is the first observation, but we have to do many more experiments using larger sample sets to confirm this observation. But at least our study is giving some clue to the role of estrogen in the neuroprotective aspect in autistic brain. In addition to estrogen receptor, we also found that the enzyme which is involved in the conversion of testosterone to estrogen is also low in autistic brain. So we have 2 key observations here. One is an enzyme which is involved in the production of estrogen, and the second one, a receptor which mediates the action of estrogen in neurobehavior. So both these molecules are significantly low in the brain of autistic brains. So if we can modulate the function of estrogen receptor, probably that might be the new treatment strategy in autism spectrum disorder. So the molecule which we are finding is called estrogen receptor beta. Estrogen receptor beta agonist, those are the compounds which can stimulate the estrogen receptor beta function. They are already in the clinical trial for schizophrenia. So in case, if you think that estrogen receptor beta function is abnormal based on our study, probably that might be the next level of treatment strategy in this field. Our future studies are focusing to further understand why and how estrogen receptor is abnormal in autism spectrum disorder. Second question, as an initial step to develop the therapeutics based on estrogen receptor beta, we will test whether estrogen receptor beta agonist, which is already there in the clinical trial, can reverse autistic phenotype in the rodent models of autistic behavior. And that should give some evidence whether there is an efficacy, whether there is a rationale to use estrogen receptor beta agonist in this disorder.